is osteoarthritis. Yeah. So as I said, you'll be given that rubric that will help you. Yeah. Okay. All right.
Oh,
So
the L to the bottom, Dr. Barnett.
there you go. So I have it wrong, right? So I always remember the AP, the lateral, the fibula is always lateral. That's to help you remember. And you see, it also has a little tape there. You know what that means?
That's the right way.
No.
Oh, I don't know. Sorry.
What do you think that means?
The tape?
Uh-huh. Let me see who thinking. What do you think that is? It has appeared in the exam before. So.
Oh.
All right. So you see a lesion here, a proximal lesion. So you can see that this is involving the proximal metaphyseal region of the tibia. Agree? All right. You can see this speckled nature in the soft tissues. All right. I mean, it's not classic for what lesion is. So you see, I'm sure you see it up there already. So let's give it. This patient is a 20-year-old patient who's come with a painful mass in his proximal left leg. At night, it's very painful. Look at it. Osteoarthritis. No. See, I see. I think at least you pick up that point. Remember now again. But remember now, you see, osteoarthritis is usually found where in the bone? Within the bone. Within the bone. Somebody just pointed out. Look and see. We see all that calcification inside the soft tissue. That is not well circumscribed, as I said. How we saw the other. When we saw a benign tumor, right? If you start seeing all this speckling in the soft tissue, we hinted at it earlier. When you start seeing speckling in the tissue, that means that control of this growth. When you have uncontrolled growth equals, so you see again, so you're seeing all this speckling in there. So think about it. When you see calcification in a tumor that is expanding into soft tissue, remember we said again. So what's the most likely tumor that could be? Calcification. Yeah, so that's osteo. So it's most likely to be an
Sarcoma.
Any tumor that is a sarcoma that has calcification in it equals osteosarcoma. Yeah. Obviously, this is not a nice picture for you to show you Codmer's triangle and all the other things that describe osteosarcoma. But when you see that sort of picture of ill-defined, remember we said showing benign was nicely circumscribed, ill-defined mass. Look at it, here it's all going on down here, all this ill-defined. It's not clear for the experience, but you can see all this ill-defined thing there, osteosarcoma, right? So remember osteosarcoma now, remember where it occurs at towards near where you'll find the growth plate, because remember it's an abnormality of growth. So this is obviously, this is a child, not a child, but a young adult. Yeah. The tumor didn't just come there, but look at the size. Yeah. Remember again, I just said metastases is the most common bone tumor, malignant bone tumor. Osteosarcoma is the most common solid primary bone tumor. Again, look back at my 3 slides in the tumor lecture. The most common solid primary bone tumor.